Hey, it's Caden. It is April 4th, 2010, and today marks 20 days post-op, so tomorrow will be 3 weeks, and it also marks 2 years on T for me, so that's pretty exciting. It's been a great 2 years, but I'm just going to give you a chest update, show you where I'm at, how things are going. So, almost 3 weeks post-op. It's Sunday, so I'm changing the tape. I've changed it once before, and then he changed it once the week before. So I've been changing it every week, just once a week. It looks good. The tape really helps so that you can feel like when you're moving a little too far. I've also been wearing this since I am on weeks 3, and now I'm going to start week 4 post-op. I only have to wear that A strap when I'm active. But I'm active pretty much all the time unless I'm sleeping, and then I'm pretty active then too. I don't sit down at my job usually, sometimes, but barely. So I've been keeping it on all the time except for like an hour or two after the shower, and I try and make sure I'm sitting down, maybe on the computer. It's really hard to do, but I try and make sure I do that because I really want the incisions to look good and the scars and everything. And I think I've done a pretty good job at it. I haven't been reaching for things. I've been using step stools or asking people to get things down. Have not been stretching. Like, I really just want to stretch my arms back and up, but I haven't done any of that. So I will wait at least a couple weeks before I do that, just because I really want good results. So I'm planning on waiting till 6 weeks before I'm really stretching or moving around at all. I just don't want to ruin anything or, make it worse. Things have been great. I started work last week, so I actually only worked 4 days last week. But it was good. It definitely made me a lot more tired and sore. I've been sore really in through here and then on the sides, but work definitely made me more sore. When I have the days off, I just sort of sit around or go for walks, and I'm not using my arms a whole lot. But at work, I'm reaching for things, always using my arms, always walking around. So I've definitely been more tired. I'm still needing a lot of sleep, which I don't usually get unless I have days off. But I've been sleeping 10 or 11 hours on my days off, which I could never do before. So I know I'm still recovering, still needing sleep. No, Riley, you can come in a minute. Okay, hold on. How I give in so easily. So sleep's been good, work's made me sore, but I've been wrapping it the whole time, and that helps. Riley, you made me forget what I was gonna say. Do you want to say hi? Here he is. Say hi. Don't hit me. So it says 2 to 4 weeks, which is what I'm at. I may engage in light exercise or extra activity like walking, and I've been taking walks, but I haven't been doing anything else, like no running or lifting. I wouldn't do that until a lot later. I'm going to keep changing the tape. He said, wear it until 4 to 6 weeks, so I'm going to keep doing that till at least 6 weeks, and then I'll start scar treatment. As far as my results, I still got this little bump, but it's fine. I can work with it. It's actually quite sore, so maybe after I heal and I can start massaging it, maybe that will help. I don't know. But this nipple looks good. Sorry, I might be making it blurry now, but it's got some scabbing on it, but it keeps going away a little at a time. Drain's got a scab, so it's healing, and the incisions look quite good. These little bumps up and down are just from the tape, like squeezing the skin a little bit, so they're nothing. I don't know if he uses stitches underneath the skin, but I think he just glues it shut. The only stitches I had were the drains that I know of, but could be wrong. So it's looking good. There's still some stretch marks here, but I'll put scar treatment, Moderna and stuff on it, and that should help. There's numbness like right here. Well, that's really bad at it, and the nipple's kind of numb. I mean, I can feel pressure and stuff, but if I poked it with something, I don't think I can feel it. But it's good. Very sore right in here, though. This side, it finally attached down here at the bottom. It's a little like, this nipple seems to be drooping, so I don't know if it's the way he cut it and the way he did it, or when it wasn't healing and, you know, I was squeezing it together and taping it and stuff. Maybe part of that areola nipple got under the skin and it healed that way. I don't know. I'm just happy it healed. So it's still got some scabbing. This one's been giving me some pain. The drain hole's all scabbed over. The incisions look good. So there's still kind of some extra something over here compared to this side. This side's really like flat. Maybe it's swelling, but I actually feel stuff, so I think it's tissue. It doesn't look awful. I got cat hair now attached to the like residue from the tape. Yeah, but that's it. I'm gonna try and move the camera so it may be out of focus for a minute and shaky, but so maybe it'll get in focus, hopefully. This is what it looks like. I'm not that pleased with how big my nipples are, but yeah, that's the way it goes. I'm just happy to have a flat chest. So hopefully it'll be in focus again. So this is my chest. 3 weeks almost post-op. It'll be 3 weeks tomorrow, and 2 years on T. I went to D.r Steinwald in Lake Forest, Illinois, at Lake Forest Plastic Surgery. So you can look him up, but he does great work, and he leaves the nipples attached to this nerve stem, so, or whatever that is. So hopefully I'll still have feeling, but we'll wait and see. I do feel like occasionally little pinpricks just in one spot with the nerves growing back, but it's not too bad. Here you go. If you have any questions, let me know. Talk to you later. Bye.